Good afternoon, everyone. We've hit the noon hour on Thursday, so let's get our weekly COVID-19 situational update underway. Thank you very much for joining us today. Pleasure to have you here. Let's take a moment and start with our land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 and Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, let's hear from our Board of Health Chair, Mayor Andy Mitchell, for some opening remarks. Please go ahead, Andy.
Thanks, Brittany. This week, the province began a phased approach to reopening. New measures have included opening restaurants, recreational facilities, and increased social gathering limits. This is positive news for residents and builds on an earlier provincial decision to return to in-person learning. It also builds on projections put forward by the science table that indicates cases will continue to drop, but only if we take appropriate actions. The science table data is clear. If we let our guard down, we will likely see an increase in new cases. Actions designed to reach the best case scenario outlined by the science table fall into three broad categories: prudently managing our individual risks, starting or completing a course of vaccines, and continuing to follow the public health measures in place. Managing our individual risks is about understanding them. Are we immune compromised? Are people who we live or work with at increased risk? Have we availed ourselves of vaccines? Are we required to be in regular and close contact with others outside our household? The answers to these questions should help guide our actions, especially the number and type of daily interactions we engage in. Vaccines are the best tool to protect ourselves. Individuals with a full course of vaccines are far less likely to be hospitalized from COVID, far less likely to require treatment in an ICU, and far less likely to die from COVID. Continuing to follow key public health measures is important and include wearing a well-fitting mask when indoors or outdoors where you cannot maintain physical distancing, adhering to indoor and outdoor social gathering limits, respecting capacity limits, and very importantly, if you are ill, stay home. Learning to live with COVID is not about ignoring COVID. It's about adjusting our individual behavior to manage our risks of COVID well, at the same time, taking public measures that help protect our community. To all those working so hard to keep all of us safe, thank you. Stay safe, be well, and in all things, be kind. Thank you.
Thank you so much, Mayor Mitchell. Okay, let's work our way through the next slides showing the data. I'll invite Dr. Piggott to explain these to us. So go ahead, Dr. Piggott.
Thank you so much, Brittany, and good afternoon, everyone. I hope you're keeping well and staying safe out there with the snow and slippery conditions. I'll start by talking a bit about our data and then share some remarks. And I'm also going to share some of the Ontario Science Table's modeling data, which I think is important and illustrative as well. To begin here with our vaccination rates, they are continuing to increase slowly. Our total population eligible with 2 doses is just shy of 82%, and we're nearly at 60% for our 3rd doses. But really, especially on the 3rd dose front, I think we need to do everything that we can to continue to help improve that number, that 60% number, and keep increasing it, because we know that the boosters are not only important to preventing more severe disease and death from COVID-19, but also to stopping the transmission of the infection in our community more broadly. And I do want to share, starting today, all our clinics at the Healthy Planet Arena are now open for walk-ins of any age for any dose. Beginning tomorrow, we will also have a clinic in Buckhorn where walk-ins will be welcomed, and you can check in on our website to see how to access appointments, but we are really trying to do everything we can to make them as accessible as possible at this stage. On to our next slide here, you can see one area that we really still want to keep working and encouraging people to come forward in is in our 5 to 11-year-olds. They've had at least one dose, just over 50% of them, and it is good to see that we've had a 10% jump on our second doses from last week, which is people starting to become eligible and get their second doses. But really, with schools continuing to be open and protecting kids as much as possible in them, the vaccine is the most important tool in our toolbox for those who are eligible. On to our next slide, you can see our active case count and death dashboard. I want to share my condolences for the most recent deaths that we reported yesterday, and the fact that really this week we've now reached a very tragic landmark, which is passing 50 deaths in our community. And since early in December, we've seen a doubling of deaths for reasons that I discussed in more detail last week. But what this is unmasking, what we're seeing in the Omicron wave of this pandemic, is with the large amount of infection and transmission occurring, we're seeing a more vulnerable population in our region, an older population, more retirement residences in long-term care settings, and more people who ultimately are vulnerable to the severe impacts of COVID-19. On to our next slide here. The hospitalizations continue to be concerning. It shows that there are 20 inpatients currently, and that the hospital is doing great work to continue to manage the outbreaks that they are encountered with. What the data doesn't show is the continued impact that staffing is having when we talk to our hospital partners. It continues to be a serious concern and challenge, especially with people who end up being off because they are sick or isolating due to exposure or infection with Omicron. On to our next slide, we have declared 2 additional outbreaks over yesterday. And so we've seen a decline from 16 to 14. This is obviously good news, but we continue to have new outbreaks on a regular basis. And that is, of course, concerning, especially in settings where the individuals would be more vulnerable to the impacts of severe COVID-19. On to our next slide, we can look at some of the data from Professor Kyle and team at Trent University. And we did hear from them and the support that they've been doing with our wastewater surveillance program last week. But I do want to provide an update on that data. What it shows overall is that we've seen a recent bump, and you can see a smooth line. So the dark blue line is the smooth line because of individual daily fluctuation. There's a bunch of factors, as Professor Kyle has told us, including stormwater and temperatures that can impact the levels detected. But what we've seen clearly is a trend towards an increase after a steady decline. And unlike previous waves and outbreaks that we've seen with COVID-19 to date, this did not follow a clear decline rate to decreasing down to nearly nothing again. We continue to have high transmission with Omicron in our communities, as evidenced in the wastewater. And so it hasn't declined clearly, but it has stabilized and plateaued. And what we may be seeing with the small increase towards the end there is increased transmission as kids went back to school and as our measures have started to be relaxed from a public health measures and lockdown standpoint. On to our next slide, you can briefly see the trend in Lakefield and the following trend in Millbrook. I urge caution in interpretation of this data because of the smaller community sizes, but in both cases it reflects the same pattern that we see in Peterborough overall, which is that there was a steep incline with Omicron. It has certainly decreased, but it hasn't gone down to nothing. There is a stable, plateaued, continued transmission. I'm now going to share a couple of the science table slides, which I'd just like to point out because there is some interesting modeling data that they have done. So I'm going to share my slides now so you can see this. And we're good, Brittany?
Yep, looks good for me.
So the reason I want to highlight this continued work from our provincial Ontario science table is that modeling is really important. Just because the weather's good outside now doesn't mean the weather will stay good, and that's why modeling, like weather forecasts, are important to knowing what is coming. Right now, they say in the context of the restrictions lifting, there are a range of possible scenarios, from the green or good scenario at the lower end where infections would continue to decline, perhaps plateauing or decreasing further, to the upper range, which is that we haven't yet reached the peak and that there could be a higher peak beyond the one that we experienced more recently with Omicron. This is, of course, very concerning and should caution people to exercising caution in their activities and their decisions and the risks that they take, because continued precaution will be very important so that we follow a trend towards a lower line. The thing about modeling like this is it's all contingent on what people do and the actions each and every one of us take, and the path that we will follow will be dependent on those actions and those risks and the measures that we continue to take to prevent risk of infection. Looking at the vaccination data, we continue to see a tremendous benefit of the vaccine for patients who are in hospital or in the ICU. You can see the higher line in orange demonstrating the rates in unvaccinated individuals and the rates in vaccinated individuals being dramatically lower. And not none, but so much lower that we know that the vaccine is having a tremendous benefit. A 6-fold decreased risk of hospitalization, a 12-fold decreased risk of ICU admission, and even more protection against death. I'm going to finish sharing those science table slides now, and I'll turn it back to you, Brittany, to continue with the presentation. And I'd like to now speak a little bit about something we're all talking about and thinking a lot about, which is what's next and what happens now. I want to touch on this idea of learning to live with COVID-19, because there's a good deal of discussion that has been transpiring. And Brittany, I'll just see if you can share your slides. There's a good deal of discussion that's been transpiring on this in the media. How do we learn to live with COVID?
Sorry,
sure
there we go.
Yeah.
Sorry.
Oh, I shared my screen. Is this working now? I can continue unless it's working for you, Brittany.
I think if you can just continue with your slides, I think that'll be best.
Sounds good.
Thanks.
Okay, so what I want to talk about is what's been circulating in the media around learning to live with COVID-19 and the fact that we've been with this pandemic now for over 2 years, and it continues to be a significant challenge and impact. And as we've seen in the data that we have looked at on the Omicron wave, it's been the most deadly period in the pandemic to date. That being said, I think all of us agree there are parts of this and the virus that will be here to stay and that we need to learn to live with. But what I want to mention is that the transition that is happening now, with the vaccine having been so protective and Omicron now more mild than previous variants, the transition we're seeing is that people who are more vulnerable in our communities are the ones that are going to pay with hospitalizations and deaths. And despite the fact that it will overwhelmingly impact people who are more vulnerable, including not only the elderly, but people who are immunocompromised, have medical risk factors for severe COVID, or who, for their own decisions, haven't yet become vaccinated. The pandemic will continue in its strength and negative impacts for those people, but it will continue based on the decisions that each and every one of us make. And so, as much as there has been lots of conversation and talk about the negative impacts about some parts of this pandemic response, namely the lockdowns, I want to share continued sympathy and empathy with those impacted, because we do not take this lightly. And the provincial government in its decisions around measures does not ever take these decisions lightly, because they can impact people, social isolation, businesses, families, and they can have negative impacts. They've been necessary to save lives, no doubt about that, but they have negative impacts. And so as we emerge into this next stage of learning to live with COVID, what I want to highlight is that there are measures that each and every one of us can do and can take that don't have the same degree of negative impacts that the more heavy measures like lockdowns do. Continuing to wear tightly fitted masks, as per the guidance, especially when you're congregating around other people, but ideally anytime you're around anyone outside of your household bubble. Getting vaccinated if you haven't been yet, and getting your third dose if you haven't had that yet and are eligible. The vaccine is the most important tool. Staying home when you're sick. Getting tested if you're eligible and using rapid antigen tests as you're able to. All of these measures will continue to help us in preventing the transmission, and they will continue to help us in saving lives of those more vulnerable in our communities. And so it is on us to continue this process and continue all of the protections that we can as we go down this journey of learning to live with COVID-19. Want to mention one exciting development, which is the approval of a new treatment for COVID-19. It's a treatment that is very effective, even against the Omicron strain, but it's going to be a complicated treatment, and it's important that people understand who qualifies and how to access it. At this stage, there's extremely limited supplies provincially of this medicine. And so there have been 15 assessment centers, clinical assessment centers identified in the province. The closest for the Peterborough Public Health Region will be Lake Ridge Health. And in conversation with our partners at Peterborough Regional Health Centre, they are working actively to plan what access means and will look like in our region. And there are conversations of a hub and spoke model for closer access. And so people in this community will start to become eligible for this medicine, and this medicine may save many lives. At this stage, because of the new evidence and the very limited supply that is available to the province, individuals who qualify include those who are immunocompromised, people who are 60 years and older who have a medical risk factor who are unvaccinated, people who are 50 years and older who are unvaccinated and live are Indigenous peoples or live in Indigenous communities. What is most important to know is that getting access to testing and starting this treatment needs to be done very quickly, within 5 days, for this to be effective. And so people should start to be aware of this if they are in a group that's currently eligible. And you should reach out to the assessment center at the PRHC for an appointment to get tested and to see if you do qualify. Because again, starting on this early will be what's important for it to be effective and to potentially save lives. I do believe that there will be an expansion of eligibility, and it may be a more useful tool in the toolbox as more is available. But right now there is so limited available that these are the restrictions placed around that. But I did just want to take a moment to share that for reflection amongst people listening, and I'm happy to take questions on that or other pieces after our next section here from our local elected officials. And I'll turn it back to you, Brittany.
Great, thank you so much, Dr. Pigott. I believe we have MPP Dave Smith with us today, so I will invite you, MPP Smith, if you've got some comments to share.
Thanks, Brittany. I appreciate that. I do have a couple small things. First off, I want to thank the scientists at Trent University, because the work that they have been doing with the wastewater, it's kind of cool when you look at the results that they're getting, if you ignore the fact of what they're playing with. But what they've been able to show is that as hospitalization has started to come down as well, we're seeing less of a viral load in the wastewater, and they can track that and make projections based on that. And this is information, this is data that we didn't have at the beginning of the COVID crisis. They have done a fantastic job getting this information, sharing the information, and helping the province of Ontario move forward with a lot of what our plans are. So I take my hat off to them, and I thank them so much for the work that they have done. With respect to where we are in the province and how COVID-19 is going, there are some measures that we have tried to take all throughout. And let's talk about testing a little bit. When COVID first hit, we had lab capacity of about 6,000 PCR tests per day. That ramped up to well over 100,000. Now, we had to make some restrictions on it because of Omicron. When Omicron came in, we were probably looking at between 250,000 and 300,000 tests per day if we were to remain at that same level. And unfortunately, we didn't have the lab capacity, and we didn't have the ability to ramp up that lab capacity in such a short period of time. We turned to rapid tests, and we deployed more of them. We secured a greater supply of it, but even that, we were in a position where globally, rapid tests were being taken up by every other country. There are 2 at present that are approved for use in Canada. And because there are only 2, it limits our supply somewhat. We're in a position right now where we have a good, reliable supply to make sure that we can service and help healthcare, long-term care, first responders, and a few others. We're not quite at the spot where we can have that general distribution to the public again. Please bear with us. It's not that we don't want to do it. It's that the supply is not there for us yet. We had expected by the end of January that we would have more than 50 million rapid tests come into the province between Christmas and the end of January. We've had about 10 million come in over that time period. We received a signal from the federal government that the 15 million that they had promised was being dropped down to 2.5 million. 13 million or so were not going to come in. All of those things had a factor for us, and we had to change some of our plans. As the rapid tests become available again, we will do distribution to the general public. We will distribute again to businesses. But we need to make sure that we have them available at the moment for healthcare, for long-term care, for first responders, for those who are in the most vulnerable positions. So please bear with us. The last thing I want to say is with respect to Pavloxivin, the new treatment. It does look very, very promising. And as Dr. Piggott said, there is a limited supply. I want to put that in perspective for everyone. There are almost 15 million individuals in Ontario, about 14.8 million. We have 10,800 doses that have come in, and we do not have a date yet for the next shipment. So there is a lot of hope. There are a lot of people who are excited about this because they know that this drug, or they expect that this drug, is going to reduce hospitalization and has the great potential of saving a lot of lives. But again, it's one of these cases where there's a very, very limited supply. So we're prioritizing it for those who would most likely have a case of COVID that would kill them. It's not that we don't want to help everyone, but we want to make sure that we are keeping the death toll as small as possible. So again, please bear with us and accept that It's been triaged and prioritized for those who are most likely to die as a result of COVID until we have a better supply, until we have more of them coming in. We don't have a date yet where the next shipment is coming in. There is an expectation that the manufacturer is ramping up and there will be more coming, just like with the vaccines. When we started getting vaccines originally just over a year ago, there was a limited supply. And as the manufacturers were able to increase their production, we've gotten to the point where we can vaccinate more than 30 or 300,000 people on a daily basis. We'll get there as well with the other drugs, but it will take a bit of time. I also want to thank Dr. Pigott for everything that he has done. The information that he has shared, the approach that he has taken has been extremely well received. I can't thank you enough, Dr. Pigott, for what you have done. And I can't imagine what it is like as a young father to have uprooted your entire family, moved halfway across the country to a small community as well to make sure that we're safe. So thank you for everything that you have done. That's all from me, Brittany.
Thanks so much, MPP Smith. Thank you so much for joining us today. Okay, now we will get a chance to hear from our media guests. So I am going to start with our friends in radio. Matt Latour, I think you're with us today. If you've got a question for Dr. Pigott, please go ahead.
I am. Mine has to do with this the COVID-19 treatment that's been discussed. I know we've talked a lot about getting vaccination rates up there. Now that there's a treatment for people that are unvaccinated, is there any worry that, you know, it's almost incentive for people not to get vaccinated?
I think there are two different ends of the equation, and I don't think it will be. It's prevention on one hand. We know that the vaccine is tremendously safe and effective at prevention, and it's treatment at the other end. Just because you can get a blood transfusion, you know, after a car accident doesn't mean you're not going to wear your seatbelt, drive safe, and wear an airbag. So those kinds of measures, the vaccine and all of the other tools in our toolbox to prevent, I think, will continue to be extremely important. And like MPP Smith has emphasized as well, the access to this medicine right now is extremely limited, and people should not be thinking about it as a panacea. Unfortunately, beyond the fact that it's limited, there is a fairly narrow group of individuals who will actually be able to qualify for this treatment, because there are some other medicines that if people are taking or medical conditions, it would preclude them from being able to get this due to interactions. So it's again, another tool in the toolbox. It'll be important. I do believe it'll save lives, but prevention and especially the vaccine remain our best strategy.
And my other question was just, do you know any, and if I missed it, I'm sorry, I've been kind of in and out of this room. Is there any additional information on the most recent deaths locally as far as age, their gender, which variant they had?
Brittany, I'm not sure if we have that compiled, or we can definitely get back to Matt on.
I do have that information that I can send you, Matt. If there are specific ones that you're looking for, we can take that up offline if you like.
Yeah, that would be great. I can shoot you an email. That's it for me. Thank you.
Thanks,
Super.
Matt.
Thank you, Matt. Okay, I see Jessica Nisnik is here with us from Global News. Do you have some questions today for Dr. Pigott?
I do. Thank you, Brittany. And mine are going to be focused around the medicine as well. So, Dr. Pigott, sorry if I missed anything here, but so the medicine is to treat people with COVID?
Yeah, the medicine is to treat people who have a confirmed diagnosis either by a rapid test or a PCR test of COVID-19 to prevent them from getting more severe disease and ending up in hospital or passing away from COVID. But again, it's a more limited group of people who are eligible for this. and what's most important. And the reason I brought it up today on behalf of our PRHC partners, which are leading the charge locally to ensure access to this medicine in our community, the reason I brought it up is people need to start to be aware if they are in the eligible groups, including people who are unvaccinated and over the age cutoff or immunocompromised, they need to attend and get tested early because this medicine needs to be started within 5 days of illness, which means if you're one of those people and you have symptoms, you should be coming and presenting to the assessment center here in the community at PRHC as soon as possible so that you can get tested, and if you do test positive, be considered for this medicine.
Okay, and do you know, can you fill us in a little more on what it's like? Is it oral? How many times would you have to take it?
Yeah, it's a 5-day course of oral treatment.
Okay, and is it just me, or maybe I'm too focused on other things happening right now, but did we know this was coming out? Is this...
There was, there was some broader national media attention, no doubt, when the US approved and then subsequently Health Canada approved this medicine. But in the current time period, it's in the early phases of rollout. So I just wanted to get out here and make people aware of it. I know that our link with Lake Ridge Health is working on the communications and promotion of this, as well as PRHC as the local arm of this. So I think we'll hear more in coming days, but I really just wanted to start to get the message out there, because if people aren't aware that there is this option, especially for people who are immunocompromised or unvaccinated, then they won't know that they do need to come for testing early so that they could potentially be a candidate.
Well, this is amazing. One last question. I know you said it's early rollout. When can we see, when do you think we will see this being available for folks?
I think that question is probably best directed to our hospital partners, PRHC. I don't have an exact date at this point, but I do know that it's soon, and they're working tirelessly to set up the process for this.
Okay, just two more questions. Lake Ridge is the closest place, but if someone wanted to go somewhere else, can they do that? Or is each area being directed to go to a certain place?
There are protocols being set up depending on if somebody comes to see their family doctor first or to an assessment center. They will not need to necessarily go to Lake Ridge to have that process done. And what I would encourage people to do is to direct their questions, and as well, if they're qualified, to book an appointment if they do develop symptoms at the assessment center here at PRHC. And as soon as that's available, I know that they'll begin to ensure that patients have access to this treatment. But it will all be merging, and I anticipate more information will be coming, including from PRHC, in the coming days.
Excellent. Very exciting news. My last question is for a colleague who's working on something else. She's working, when, in your opinion, do you see maybe mask mandates lifting?
I think that's a policy question for the province. I'm not sure what the answer to that is now, Jessica. I know that masks continue to be a very safe and effective and minimally invasive opportunity to prevent the spread of COVID and to save lives through preventing transmission. I know that it can be cumbersome, but so was the seatbelt when we started wearing it. No, I don't think eventually we'll be wearing masks year round, year out. I think there may be times when people will want to wear them more than others, but from the standpoint of the provincial mask mandate, I'm the wrong person to answer that question.
No problem. Just had to ask. Okay, thank you, Dr. Piggott. That's it for me. Thank you, Brittany.
Awesome. Thank you very much, Jessica. Okay, Paul Rellinger is here with us from Kawartha Now. Please go ahead, Paul, if you've got some questions for Dr. Piggott.
Thanks so much, Brittany. I do. Hi, Dr. Piggott. How are you?
Hi, good. Thanks, Paul. Thanks for being here.
Thank you. I really only have one question, and I apologize. I think you may have answered this maybe in other forms, but I'm just trying to kind of nail it down. People are watching numbers very carefully. The number of cases, not only active but certainly new cases. What's your advice to people who are watching these numbers if they're looking for hope that things are getting better? And we're hearing that we're hearing that suggestion on so many fronts. The Premier has even indicated that. What should they be looking for that doesn't necessarily spell an end to the pandemic, but shows them that we're on the right path and encourages them?
Thanks, Paul. I think that there are a variety of pieces of information that we can turn to. There continues to be pieces of information that signal concern. There continues to be wastewater surveillance that's detecting transmission of Omicron, though it is down. There continues to be significant number of deaths we're seeing in this community. There continues to be a burden on the hospital, but we've certainly as it pertains to the history of this Omicron wave, surpassed the worst of it and are in a better position. What we don't know is what will come. I think that I'm very encouraged by the provincial approach to a cautious reopening and really assessing and evaluating all of the data as it emerges and as the public health measures are relaxed. I think that is the right approach and really important to be cautious in this and to watch for a signal that things could worsen. But like the Ontario Science Table demonstrates in their modeling, we could be in a position where we will continue to see a decline of cases in the coming weeks. We could see a rebound. We could see something in between. So at this point, I think that as people are making their own personal decisions, it's really important to still follow the guidance and limits. So at a personal level, the private gathering size is now 10 indoors, and so continuing to follow those legal limits and to follow the limits that are placed by the province on businesses and other settings is really important. But beyond that, I think at an individual level, especially if you're concerned about your own risk or vulnerability or those around you. You know, I myself still have 2 young daughters who haven't had their turn to be vaccinated, and I may be more cautious than somebody else may feel they need to be. But I think if we can all be in this together and do each and everyone's part to decrease unnecessary risks, then we'll start to emerge and see the other side of this very soon.
Just one more thing further to that. You don't have a crystal ball, and I know that, but are you optimistic? Like when the province, I think, has set their next deadline for a review as February 21st, I think it was. Are you optimistic? If we do all the things that you just said, how hopeful are you that we can progress to that next stage?
I think if we do all the things that I just said, then yes, I think we will continue to progress. But at the end of the day, this does account for people's decisions and behaviors. What I have issued locally is a letter of recommendation. It's a recommendation only under the Reopening of Ontario Act. Because of the underlying vulnerability in our community and the older population, if people can continue to work from home without that having significant negative consequences, I think it's still very much a good idea to do that. There are measures, and I really want to separate. There are measures that have negative unintended consequences, and those are the things we need to ditch as we move forward to living with COVID. We can't keep impacting people, their isolation, businesses and families in our community in a negative way. But there are things each and every one of us can do. Getting vaccinated, wearing your mask, making sure you're adhering to the public health guidance, staying home if you're sick, seeking testing, using rapid testing if it's available. All of those things don't cost and impact us in a significant negative way, and they will save lives. And we've reached the stage in the pandemic where the lives that we're losing are those more vulnerable in the community. So it's on each and every one of us to do everything that we can to help to protect those people too.
Thanks so much, Dr. Pigott. I appreciate it. Thanks, Brittany.
Great, thank you, Paul. Okay, I see Taylor Clydesdale is here with us today from Peterborough this week. So go ahead, Taylor, if you've got some questions.
Hi, thanks, Brittany. Just for Dr. Pigott, so we're at the point where restaurants are opened up to, I believe, 50% capacity. And just walking around downtown last night, I was seeing a bunch of folks sitting down at tables. Do you have any advice for folks that are kind of partaking in the restaurants and the gatherings that the current capacity limits are allowing for?
Yeah, I think continuing to adhere to measures is really important. You know, what I'll say, Taylor, is in the lead up, if you remember, just after a week after I started with the organization and moved here in December, I issued a letter of instruction to local businesses to try to take some additional enhanced measures, and the hope of that was acting early so that we could avoid further negative impacts and lockdowns. And I think continuing to take measures both at a business and patron side that decrease unnecessary risks is helpful. So for businesses, we've been advising and talking about tightly fitted masks, the improvements to ventilation systems, even natural ventilation, cracking a window and door, ensuring that spacing and airflow is good. All of those kinds of measures and things can decrease risks and still allow people to enjoy and operate their businesses, attain their livelihoods. And from a patron standpoint, I think recognizing that by all of the rules and regulations and what the business has put in place. But things like wearing your mask are still very effective. They haven't invented a mask you can eat through yet, unfortunately. So, you certainly do need to take it off to eat, but there's no reason that you need to take it off the whole time that you're at the table, and trying to maintain and continue to wear it in between is a little bit of enhanced protection for yourself and those around you. So those would be some things that I'd say. And above all, the most important message to drill home is that we cannot leave the house and go out unless you need medical attention if you're feeling sick. If each and every one of us could stay home when they feel sick, it won't prevent 100% of COVID, because there's an important component where people don't have any symptoms at all, but it'll take a lot of the burden of transmission away. So certainly for people going out, please, if you are sick or if you're working, stay home. If you're sick, follow the isolation guidance, and that'll help to protect all of us.
Okay, awesome. Thank you. I just had a question about booster shots and the likelihood that that at some point in the future we might be looking at fourth shots, or I guess it would be second boosters. Do you think that is likely, that fourth shots will be something that we'll see in Ontario and Peterborough at some point? And given the uptake that we've had for third shots or first boosters, do you think that people will go for a fourth shot?
Thanks, Taylor. There are many more scientists whose full-time job is to study this data, follow this, and help to give recommendations to us on this. So I would defer to them, and they are deliberating and watching. Part of the challenge with this pandemic has been building and maintaining the safety of the plane while we're flying it. So these vaccines were rigorously studied and concluded to be safe and effective when they were issued, but we didn't have 10 years of data on how many and if any boosters you would need. So those are scientific questions that continue to be part of the conversation. I think there is a possibility we will need additional doses. It's not to say it would be every year. It's not to say it would be many, but the science will tell us in time, and people will know, and we will recommend what the science tells us. I think at this stage it would be too premature to say, because there are a range of possible scenarios. One is that additional doses are helpful. Another one is that these mRNA vaccines may be tweaked and manufactured in a different way, which is something that happens with the flu shot every year. We tweak the strains that are in the flu shot to tailor it to what's circulating. With future variants, this may be the case. We know that this vaccine is still very good, but wasn't as good against Omicron as it was against previous strains. There are Omicron-specific mRNA vaccines that are in development now. That may be part of the conversation. There may be other vaccines that are effective against a multitude of variants that we may look at into the future. But I assure you there is a whole contingent of scientists and advisors working at a provincial and national level on these topics and these issues. And as soon as they know, they'll be recommending to us so that we can make sure everyone's protected.
Okay, thank you. Just my last question here. kind of a crystal ball question, but I figured I'd ask it. But you know, you showed the provincial projections and said that there were a couple different possibilities for what could come after Omicron, but that those, you know, what comes next is dependent on our own actions. Given our actions up to this point, what do you suspect is the most likely projection that is accurate? What do you think is going to happen next, given where cases and vaccinations are right now?
With the Omicron wave and continued?
Yes.
I have a lot of faith that the vast majority of people in this community and in our region will continue to do their part to take measures to protect themselves and those around them. So I think that we're on the right track, and I think that we will continue to see this decline and progress. But, you know, my crystal ball broke a while ago. We need to be nimble and adapt to the evidence as it comes out, which is what the provincial governments indicated that they'll be doing with their cautious approach to reopening and review of the data. And so we will see, and at the end of the day, it depends on each and everyone's actions and us all doing our part. So I hope that people really do take that message to heart, and a little bit of slow and steady action and continued precautions now will prevent the yo-yo that we've seen in previous times of the pandemic from continuing, I think.
I know a great crystal ball repair guy. I'll have my people contact your people. All right, perfect. That's all for me. Thank you so much.
Thank you so much, Taylor. Okay, I'll invite Reg Watson from the Examiner. Any follow-up questions, Reg?
Just a couple quick questions on other areas. First off, I've noticed that the cases lately have swung more to female than male. It's up to 53% female, whereas late last year there might have been slightly more male cases. I just wondered if there's anything you attribute that to. Is it just because there may be more women working in the high-risk settings, or is there any other factor that would cause the female cases to rise?
Thanks, Reg. I would say this firstly, the numbers are too small to read too much into small fluctuations like that. It's within what we'd call our margin of error one way or the other. I don't think that more women than men are getting infected. We don't see a dramatic difference in our vaccination uptake across the whole population. So I think that really this may either be no story in that, or it could be a slight signal towards the eligibility criteria, which is not only those working in highest risk settings, but those at more vulnerability of severe COVID. And you know, we know the average life expectancy of women is longer in Canada than men, and so broadly the criteria may be selecting a little bit that way, but ultimately at the end of the day, I'd say a few percent like that. It may swing again in the next coming days too, so we can't probably read too much into that.
And just following up on that, do you expect the PCR testing to expand again in the near future now that maybe some of the daily cases are coming down a bit?
I think questions on PCR eligibility and capacity are probably better directed towards our provincial government or our chief medical officer of health. I'm not sure at this stage.
Okay, thank you. That's everything then.
Okay, great. Thank you so much, Reg. And our tracker does show case breakdown by gender, and you can select different timeframes. So that might be another way to look at the data that might be helpful for you. Okay, thank you so much, everyone. Thank you, Dr. Pigott. Before we sign off, I did want to share a change to our briefing schedule. We will be moving to a bi-weekly media briefing every second Thursday. So but we will hold one if needed, if an urgent situation arises. But at this point, we are going to be holding our next one on February 17th. And we recognize that we will be available though for media requests that come in the meantime. So please do not hesitate to reach out to me, and I'll do my best to get you a spokesperson for your question. So thank you all again. We'll see you back here in 2 weeks, and stay safe and appreciate your support through these. Take care.